tied to the environmental challenges we're looking at is, of course, climate change. These are the ice core results from the last 399,500 years, up, down. The temperature follows CO2 levels over time. When they look at the air bubbles, look what happened to CO2 over the last 400 years. If you walk into the National Academy of Sciences in Washington, D.C., etched in stone on the far wall, the size of a billboard, is this. And I bet most American kids do not know what the Keeling curve is. So if you learn nothing, the Keeling curve is the respiratory, the CO2 levels of planet Earth over the last 50 years. So when my brother Mark was born, the level of CO2 in the atmosphere was about 315 parts per million. Today it's about 385 parts per million. That's one lifetime. This is not geologic time. This is one person's lifetime. And look at the respirations of planet Earth, the CO2 level, just over the last 5 years or so, to go from 378 up to 386 just since kids went to college in 4 years. And this is remarkable how fast it's going up. By the way, it goes up, well, I won't go through why, but the thing that's most alarming about this is that the trajectory is not, we always sort of look at this and look at it as a snapshot rather than one frame in the middle of the movie. Real-life scientists went around and measured temperature levels on planet Earth. They went back and calculated them all over the last 100 years. There's temperature increases over the last 100 years on planet Earth. Actually, it's Northern Europe. There's temperature increases since the year 1900. That's the trend of increase. Temperature increases since 1960, and temperature increases in my son's lifetime. Any doctor that was ignoring a patient that was retaining CO2 and running a fever like this with an aggressive increase would be guilty of malpractice. The air has gotten hotter, the oceans have gotten hotter and contain more CO2 and have become more acidic, and the ground has gotten hotter with agricultural impacts as well. So where do we go from here? I'm going to argue that the cross-domain solutions, which is the reason we're all here from our different disciplines, brings us here. I served 2 years on the board of directors of the American Institute of Architects. There was a whole survey of American people. This is the most iconic building in the United States for people to recognize. It was built during the Depression. This is the Workhorse Bridge of the New York area, built during the Depression, the most beautiful bridge in America, in my Northern California opinion, built during the Depression. The Workhorse Bridge of the Bay Area, built during the Depression. The dam that was probably responsible for a lot of the development of the southeastern U.S., built during that same period of time. And the dam that helped win World War II, because we would not have had the aluminum production, the Grand Coulee Dam, built during the Depression. If there's ever a time you're going to build something, it's during a time of recession and going forward. There are health solutions to this epidemic, and I won't go through a bunch of the nutritional ones, but one is people need to walk. At any age, this is the best possible exercise. People that walk 10,000 steps a day reduce their risk of becoming diabetic by as much as 50%. I'm now talking type 2 adult, quote-unquote, adult-onset diabetes, not just childhood diabetes. This book that just came out this morning is Chris Lineberger's book about creating urban areas that work for people and encourage socialization. I haven't read it yet, but Chris is a great leader and a great guy. Here's a very scientific journal that's given us a report on how we should build streets. You ever notice in the checkout line the word sex appears in every single magazine on the cover? And Dan Burden did an article on walkable cities, healthy cities, and how streets ought to look. If you want people to walk, you've got to create places that entice them and make it enjoyable to walk. It's safe. They don't feel affected by cars. It has eyes on the street that welcome us to be where they are. Have trees. Trees, by the way, prevent malignant melanoma. Well, I'm overstating it. People need to walk up and down stairs. And so when I was state health officer, I picked obesity as my number 2 priority in that job. And one of the things we argued with the governor for was that all new state buildings have pleasant and attractive stairways when you walk in the door. 1 flight of stairs a day, every day for a year is a pound of body weight. You know, we've all probably gained more than that, but that's not bad if you do it for 30 years. This is an architect friend that put stairs in place and said they were not only beautiful, but they created a social network that didn't agree otherwise. Kids need to walk to school. It's ridiculous that they're not using the legs that God gave them to get back and forth to school. And kids behave better, learn better. But it also means where we locate schools and how we create neighborhoods is important. Safe routes to schools really do work. The programs that both physically change the environment so kids can get there safely. You may need to have parents present for that walk to school, and you need to have the PTA and the school board own that walk to school activity, but they do work and kids walk considerably more. I am really, really proud of this. This is the American Academy Pediatric Statement on Designing Communities to Promote Physical Activity in Children. It's the first time in my memory that there's ever been a statement by a medical association saying people need to live in neighborhoods that are walkable, accessible, entice them to pursue physical activity. It's now being looked at, Jonathan, by the California Medical Association, the Heart Association, and it's already been adopted by a number of others as a statement. And this is really cool because you expect the pediatricians to say you got to get immunized and hide the toxic chemicals from the kids. But for them to say you also ought to have your child grow up in a neighborhood where they have increasing autonomy, ability to exercise and socialize with other people is a step in the right direction. If you build it, people do use it. And this is a complicated slide, but the bottom line here is in Portland, when they put in place bicycle routes that were safe, were encouraging, had destinations, got you to the mass transit or to places you really wanted to go to, the people increased their bicycle riding over and over again. It's my students at UCLA, I feel bad because some of them live only 2-3 miles away. They're trying to exercise, and it's absolutely frightening to go down many of the Los Angeles streets to get back and forth to school. And so we put them in this bind of saying exercise, eat right, and then they're taking their lives in their hands to do those very things. As we rehab our old buildings, rehabbing an old school is cheaper than tearing it down and building a brand new school. We don't do it enough. We need to have school gardens in every single school in California and in America. Kids ought to know where food comes from, and God help us, the teachers ought to know too, because a lot of them don't know it either. I love the fact that the President First Lady has put a garden on the White House grounds. I think it's pretty cool, you know, turning around the obesity epidemic. One way is to get away from processed foods that are cheap, taste good, but are loaded with calories, and move towards foods that we put a little work into and taste better and are healthier for us. This is urban edge agriculture, and there's a lot of stuff going on in Northern California. I don't know enough, almost done, down here, but the point here is Los Angeles was the leading agricultural county in the United States in 1945, both quantity of produced and value of what was produced. We then invested all of the land into housing and roadways, farmers markets work. Green space does decrease temperature, and we need to tax sugar. I now say corn sugar, but I think we need to tax all sugar, a penny a teaspoon. We ought to be using it to support Tree People projects. But no, but I'm what we're saying. But we should be investing it in upstream prevention measures rather than simply paying for stomach stapling surgery. I'll skip this. This is really about better design of homes, and you have to go see this absolutely cool little Mini Cooper out here that's electric, and Dr. Patel was showing me earlier. It was terrific. And we need to create places that not only encourage us to exercise, but encourage us to socialize and add joy and mental health to our lives, not just physical health to our lives. Let me stop at that point. Thank you very much.